This is what we are seeing across the world. And I'm hoping that won't be the case here in Sint Maarten. If we look across the world, on the left-hand side, you see what the world looked like in the 1990s. And the darker the color, I know you can't read all of it, but the darker the color, the higher the rates of obesity. And in the 2010s, you see how much of the world is becoming darker and darker. And that relates to the first picture that I shared with you. And if you look again a little bit more deeply, 1 out of 2 adults in the world is either overweight or obese. And 1 out of 5 children are either overweight or obese. And if this is a problem that starts so early in life, it stays with the child forever. And that really leads to non-communicable diseases that we'll talk about in just a minute. Why do we care so much at the World Bank? Why do you think we care so much about obesity? Because it's not just a health issue. It's an issue that has direct impact on GDP, on economic development. And this is some work done by the World Obesity Federation that shows that in 2019, approximately 1.8% of GDP was being lost just to obesity. It's lost because obese individuals are more likely to have diseases, non-communicable diseases. They need more health care. They are more likely to be absent from work, so on, and so productivity levels are lower. Now, if we don't do anything about that, by 2060, that number of GDP loss linked only to obesity will go up to 3.6% of GDP. I don't know the GDP levels in Sint Maarten, but I'll let you estimate what those numbers add up to in terms of your island, beautiful island. But I do have some numbers for some of the countries, and I know you can't read it, so I just highlighted the Netherlands. And in the Netherlands, you will lose by 2035 already more than 2% of GDP related to obesity alone. So when you're talking prevention, this is an area that really needs to be considered. And I hope as you develop your vision statement, you will think about how you will address this. I think almost everyone in this room probably knows about the health impacts of obesity. I've already referred to them. Diabetes, very closely linked to obesity. Cardiovascular diseases, again, lots of evidence to show that obesity is closely linked to cardiovascular diseases. Newer research is showing links with cancers as well, and other diseases, including depression, is being linked to obesity. So this is the health impacts, but as I said, we from the World Bank, we worry not just because of the health impacts, but also because of the economic impacts of obesity. The other element from preventing non-communicable disease point of view is sodium intake. WHO recommends approximately 5 grams of salt every day for each individual. Do you know how much 5 grams would be? 1 teaspoon. That's all that you really need to have a healthy life. In general, we see across the world, people are consuming at least about double that amount every single day. What does that mean? Approximately, it's translating into 1.89 million additional deaths each year. If we could reduce salt intake by 1 gram per person per day, that would reduce the risk of stroke, deaths related to stroke, by 7%. So imagine if you could reduce salt intake by 1 gram every day for each individual, you could reduce the risk of stroke by 7%. And again, since we work at the bank, we always talk, what does this mean in terms of returns to investment? And every dollar that is invested in scaling up sodium reduction interventions can give you $12 in return in terms of the benefits that you get from that. And I understand, I'm sure many of you know much more about this, but there is a 𝗏𝗲 plan of action which talks about, which aimed to reduce sodium intake by about 30%. I'm not sure exactly where you are, I'm not sure how that applies in your context, but that's something you might want to think about. So, you know, I've shared with you what the problem is, but as Parveen said, with the problem, we must also talk about what the solutions are. From a prevention point of view, there are many, many potentially cost-effective solutions to address both obesity, but also unhealthy diets and NC, non-communicable diseases. I'm sorry, at the bank we talk in acronyms sometimes, and so we keep saying NCDs. If you look at the list on the left-hand side of best buys that are advocated by the World Health Organization, 3 basic best buys. One is, of course, as I said, reduce salt intake. I don't know how feasible that is in your context, but you can decide how it's possible to do. The other thing, which I haven't talked about a lot, is around trans fats and polyunsaturated fats. Can we reduce trans fats and polyunsaturated fats in our diets? Is that possible to do? That is a best buy as well. And in many countries across the world, there's a huge movement to reduce these fats. And then, of course, raising public awareness through mass media on both diet and physical activity. And Parveen, you just talked about, I'm not sure what you call it, but public medical school? Medical school. Okay. So similar effort could be done in terms of raising awareness on these issues, and that can have a huge impact. In addition to that, on the right-hand side, I've laid out a package of interventions that can have additional impact. Now, these are interventions that are more related to, well, they're all at a public health level. So, taxing unhealthy foods. I know you're going to tell me it's not possible in Sint Maarten, but let's hold your thought on that one. But it is possible to tax sugar-sweetened beverages. It is possible to subsidize healthier foods. That can bring about changes in intakes. You can put labels on what are called front of package labels on unhealthy foods, so that when people are consuming it, they don't have to look at the details of the drug on a tiny text, but a nice big label that says this is high in fat or high in sugar or whatever. Then setting nutrient targets for the community, limiting access to and marketing unhealthy foods, especially in schools. That can be done and has been done in many countries. Working with public institutions where there is mass food being distributed, that can be. And then, of course, mass media campaigns, we just talked about that. And from the World Bank side, we've put together actually a global database that shows how many countries have put in place taxes for unhealthy foods. And you can access that and look at that. So that's what's happening at a global level. Like I said, I can't speak to the beautiful island, but let me just mention a couple of things. First, looking at the data that I could find, what we are seeing is that in Sint Maarten, over the last 2 decades, the population is aging. Median age in 2000 was 30 years. Now, in 2020, it was almost 46 years. So I don't know what's happening. You probably know that better. But I did look up that the number of births is going down as well. So that means you have a population that is aging and that is more likely to be prone to non-communicable diseases. We graphed GDP per capita and obesity. So obesity on this axis over here, and GDP per capita over here. And can you read this in the back at all? Yeah, you can. Okay, great. So if you see, Sint Maarten is doing really well on the GDP side. You're doing really well as compared to many other countries in the region. But you're also doing rather well on the obesity side. So you want to think about that. And it's very interesting. I had another slide. I took that out because we're short on time. But what we've seen globally is that when countries are poor, it's the poor that are more likely, it's the rich that are more likely to be poor, to be obese. So in poor countries, it's the richer, better off people who are obese. As countries get richer, as GDP goes up, obesity shifts to the poor. So the poor people are more likely to be obese in richer countries. And just looking at these data, I think if there were more data, I'd like to look at the inequities in Sint Maarten to see whether it's the rich or the poor. But at least globally, that's what it's showing us. We did analyze data for the Dominican Republic and Mexico, and that was very clear. Then some, again, data from your studies. We are seeing, if you look, the first graph on this side, that's in the world, the number of people, the percentage of people that are overweight and obese. And, you know, it is a large percentage, but not as large as what you're seeing in Sint Maarten. So it's the world, Latin America and the Caribbean, and then Sint Maarten. And again, you win the race on this one as well. Not a race that you want to win, but 70%, 7 in 10 individuals are either overweight or obese. And then again, on the right-hand side, the links between obesity and cardiovascular disease rates, very high. The other very interesting piece of information that I found from one of your studies, that among the individuals who had excessive waist circumference, 4 out of 10 of them did not perceive it as a problem. They didn't think that it was a problem. So if you don't think you have a problem, you never try to solve for the problem. And 6 out of 10 of them had never been told about their weight by a health professional. So even if they went to a health professional, they had not been told about it. So you're talking prevention, but you're not getting the advice that you need to get from your health professionals. I won't talk too much about climate change and nutrition because my colleague Stephen Lurie will talk more about it, but I just want to say that what climate change does from a nutrition perspective is that it raises prices of food, and if it raises the price of food, what that means is people are unable to afford healthy diets. And in the Caribbean, that is a bigger problem than in other parts of the world. And the cost of a healthy diet is going up dramatically. If we look at consumption of fruits and vegetables, that is again a problem. I see that Wayne is coming up. Am I running short on time? Okay. Fruits and vegetables consumption is relatively low. And one of the major reasons for not eating it is A, it's not a habit. It's not something that people are advised to do. And B, of course, prices are high. So you need to think how you're going to solve for those problems. I know that you are developing, and I can't recall exactly what you call it, but some version of a universal healthcare package as part of your vision for Sint Maarten. As you are developing that roadmap, you want to integrate preventive nutrition services into this so that you're not always just thinking about treating people, but you're trying to prevent the number of people who need to go to a hospital, who need health care. That slide, there's a link over there that shows exactly how you can do that. I don't want to get into the details of that for time reasons. I also came across something called the Healthy Caribbean Coalition, and I'm sure, again, all of you know much more about that, but the HCC talks about an action plan for the Caribbean. I'm sure there are lots of good lessons. I saw some of them, many of them focusing on preventive issues. And again, I won't go through the details of these, but a huge focus in the Healthy Caribbean Coalition on life course prevention, as well as social inclusion, which is really important. There is also a campaign under the Healthy Caribbean Coalition called Now More Than Ever. How many people in this room have heard about the Healthy Caribbean? Can you raise your hand if you have? Okay, wonderful. That's great to know. And have you heard about this campaign, this media campaign that uses social media, short message services, and TV ads, as well as radio? Have you heard about it? Have you seen any of those? No. Okay. Is that something you could do here in Sint Maarten on your own, develop something that is relevant for your context, focusing really on preventive issues? So that's, now let's go back to how the world has tried to solve these complex issues and see which of these might apply. From a prevention point of view, we talk about a framework for fiscal pricing for policies around nutrition. And that really the focus is to create a difference in retail prices between healthy foods and unhealthy foods. People don't consume healthy foods either because they can't afford it or because they are not in the habit of it. And those are synergistic. So if you can address the price issue and then use the media and other mechanisms to change habits, then you can have a huge impact. So the fiscal policies include taxes, and I won't give you all of the details, but in Bermuda, there are taxes on foods that are high in salt, sugar, or saturated fat. That's one example that can be done, but there are many other examples in other countries. In terms of subsidies, in Saudi Arabia, they put subsidies on fruits and vegetables because we had a similar issue with that. In terms of incentives, in the UK, and I think this is the case in many other countries, certainly in the US as well. If you buy a carbonated drink or a Coca-Cola and you buy it at a store and they'll give you free refills. So you buy one glass and you can go and refill it over and over again. What does that lead to? Overconsumption of sugar and really bad food. So preventing that, demoting those sorts of free refills could be a way to think. And then in terms of price controls, in Argentina they have put price caps on household goods, and that includes price caps on what we call sugar-sweetened beverages, which means if they're not too cheap, then people will consume less. So we use a combination of these things in countries to try and change habits and consumption levels. So just quickly to give you a quick primer on what are health taxes. Usually these are taxes, these are excise taxes that are imposed and that they can have on, and usually they're imposed on products that have a negative public health impact. They're sometimes also called sin taxes. I'm sure you've heard of sin taxes related to tobacco and alcohol. But the newer targets for these sin taxes are sugar-sweetened beverages, in some cases, as I mentioned, sugary, salty, or fatty foods, e-cigarettes, so on and so forth as well. And just to give you an example of a country that has done this really well is Chile. Chile has done nutrient profiling and identified foods that are high in added sugar, added sodium or salt, and saturated fat. And very interestingly, I don't know if you can see this or not, but they put these front of packet warning labels. So if you buy Frosted Flakes in Chile, the same Frosted Flakes that are sold all over the world without these warning packages, warning labels, in Chile they have this big black sign on it, the same flakes that says this is high in sugar. You want to think about it before you give it to your children. And combined with those front of package labels are marketing restrictions as well. You cannot advertise some of these things to children. So on television, you can only market them at certain times, not all the time. Not at the time when kids will be listening to or watching TV. Similarly, restrictions on sales and advertisement. And they started in that direction, Chile, and now they're working on taxation. So you can use those 4 ideas that I mentioned. Every country has used them in different ways. And just to give you an idea of what are sugar-sweetened beverages, I think everybody knows the sodas that we talk about, but sometimes we forget that even sweetened juices, orange juice that is sold to us as God's gift to mankind, it's in a bottle with a little bit of orange juice and lots of sugar added to it. It's not healthy, though it's sold to us as a healthy thing, and many of us drink it thinking we're drinking something healthy. Similarly, some sports drinks, sweetened tea and coffee. Bush tea is excellent. There was no sugar in it. It was wonderful. So these are the sorts of sugar-sweetened beverages. And the reason we want to tax SSBs, as we call them, is because they contribute to a large amounts of sugar intake, especially among younger kids. They are high in free sugars, which are much more damaging to health than complex sugars, and they're a very distinct, narrow category that are easy to target as compared to some other foods. And the kinds, I won't go into detail on this, but the kinds of taxes that can be put on these SSBs include excise tax, but it can also be import tax. So in your context, where much of the food is actually imported, this is an area you could think about. And of course, value-added taxes and sales taxes as well. And every country does whatever is appropriate for their context. There is no one size that fits all. And again, the reason we target SSBs is because it is linked to multiple health risks. I've talked already about obesity, but also tooth decay, and diabetes and metabolic syndromes and cancers and all sorts of things associated with it. So this is something that many countries are looking at. And there is this very strong evidence coming from many countries that when you put taxes on these SSBs, that increases the prices and reduces sales, and there is an impact in terms of risk factors, because a person will tell you, you can do this, but it doesn't change the final outcome that we're all interested in. Not true. It does change the final outcome. I know you can't read all of them, but when you all the little details on this, but when you do want to look at it in more detail, you'll see reductions in body weight, but also blood pressure, insulin resistance, and glucose tolerance as well. More than half the world is currently covered by SSB taxes. And in fact, if you look at Latin America and the Caribbean, you can see that many of the small islands are also covered by targeted excise taxes. So if you can read those, many of your neighboring islands are also covered by these kinds of taxes. So something for you to think about. I'm almost finished. In the UK, they put these taxes in place. They announced them in 2016. It took some time to implement them. Average sugar content. So interestingly, because the products are being manufactured in the UK, because they put taxes on the amount of sugar in those cans, so manufacturers reduce the amount of sugar in the can. So that way they could reduce taxation on that. So overall, what we are saying is that sugar content of SSBs reduced by 10%. And manufacturers and customers are moving to these lower sugar drinks. It doesn't mean diet drinks. I'm going to talk about that in just a moment. And we did see decreases in obesity levels, especially among adolescent girls. Similarly, in Mexico, they put together taxes on all non-alcoholic beverages with added sugars. And it was introduced in 2014. They excluded everything that was 100% juices, 100% juices, not just juice with added sugars. And they noticed a reduction of sales by 6.2% in 2014 and 8.7% by 2015. And they saw an increase in the sale of water. That was very interesting. And don't forget, when countries put taxes on these goods, it means an increase in revenue for the country. So Mexico saw that as well, and by 2021, they're continuing to see an increase in revenue. So it's a double benefit: reduction in consumption of unhealthy foods and increase in revenue for the country itself. And latest evidence shows, again, improvements in adolescent health and improvements in oral health. Remember, I mentioned earlier that these sugar-sweetened beverages are linked to tooth decay as well. We did see improvements in that as well. In Saudi Arabia, I can go on and on. Many, many countries are doing things like that. They have seen a 58% reduction in sales of these energy drinks in 1 year. 58% reduction. And they have seen a massive drop in consumption of these foods. I mentioned diet drinks. Diet drinks include unhealthy additives. And while we don't have as much evidence on what we call ultra-processed foods as yet, we are starting to get very, very concerned, because high levels of ultra-processed food consumption is again linked to obesity, type 2 diabetes, and there is actually a dose-response relationship over there. Heart disease, I mean, you read that whole list. Ultra-processed foods, it's really becoming very, very big concern for the global health community. But we don't know how to tax these. We don't really know that as yet. We're still trying to figure it out. And linked to that, as I said, we have emerging evidence on artificial sweeteners. People used to think that if you could shift from sugary colas to diet colas, that things will become better. But the emerging evidence is actually very concerning on that as well. On ultra-processed foods, there are lots of countries that are experimenting. Like I said, we don't have a clear guidance on how to do that. But there are lessons to be learned from Mexico, from Dominica, from Colombia, from French Polynesia, and many others as well. And this design of these junk food taxes, that's also an area that is emerging, but we don't quite know exactly how to do this. You can find lots more information on this database, so feel free if you're interested in these issues to look more on this database. Thank you very much.
Thank you, Dr. Meera. That was a wonderful presentation. Thank you very much.